I went in a coma, went septic, all kind of conditions in these hospitals. And yesterday, it's been 7 years now, and I still have the same infection. I still can't get rid of it. No matter what I try, what doctor you go after, they just say, oh, things happen. The conditions of these hospitals, and believe me, I built some of these hospitals. The condition of some of these hospitals is unbelievable, how they treat these patients. And they're worrying about Medicare. Like I said, I still got the infection yet to this day. Matter of fact, I got it right now. That's how bad it is. And about it.
And Michael's call follows the one from a former nurse earlier that says she had to remind doctors to wash hands in between. Some of these steps for prevention, Bill, these are common sense. They're not going to pay if you operate on the wrong limb.
That's a no-brainer, but things like washing hands between patients. Joseph Listerine is named for him, by the way, told the medical community that probably 140 years ago. He had trouble getting people to listen to him, but by now that should be a no-brainer. Another one, they call it death by decimal. A doctor writes out a prescription, misses a decimal point, someone gets 10 times as much medication as they need or a tenth as much, and they could die or just not get well as quickly as they could. We're more careful with our money than we are with our medications. When we write out a check, we write out the dollar amount to prevent any possible mistakes, but you've seen those prescription pads, often semi-legible prescriptions. They have something called computer-assisted order systems for physicians where the doctor will enter the prescription in a computer device, handheld computer or something similar. The prescription will be checked for obvious errors like prescribing 10 times more than necessary or a tenth as much as necessary.
Right, checks for accuracy, and it's a good system. Let's go to the phones again. Plenty of questions. Tony from Scranton on the line. Tony, thanks for being with us.
Thank you. I am not a doctor. I'm not a nurse. I'm not related to the healthcare industry in any way. But I am relatively new to Pennsylvania, and I have been surprised at the litigious way that people address the medical community. I think what you're speaking about today, infections that are preventable in the hospital, is absolutely legitimate. But you have to consider the terms used and the people that you're talking to, because when we hear this on the news, it comes across as if all hospitals could care less whether or not you get an infection. Granted, there are some out there not doing their job, and the statistics prove that, but the vast majority of doctors and hospitals are doing what they can. They're doing everything they can to heal you and to help you. And when we go in and sue, and if Medicare is not going to make this payment, we all know it's going to be passed down to people who don't have insurance or to other insurance companies that are going to have to absorb it. That may be a legitimate thing. I'm just asking you to when you present these problems, try to temper them so that the public hears not only that the hospitals are dirty and they're out to get you and a completely negative impression.
Well, I don't think we've done that. First of all, this is Medicare. This is a nationwide issue. The numbers we've been reading for the most part are nationwide, and we certainly haven't addressed any of the hospitals specifically in this area. Right. Some of our callers have. But let's talk about, she does bring up some points. What about the infections that might be on the line? You're treating someone in a hospital for cancer. Their immune system, due to treatment, is down. They might be more likely to pick up an infection. Where do you draw the line that, oh, the hospital caused the infection, or maybe the nature of the whole treatment, it wasn't something that could be easily prevented?
Well, the specific 5 types of infections that Medicare is now not going to pay for are infections that the medical community and experts have agreed are preventable infections. They did not include, for instance, staph infections, which are a huge problem in hospitals these days because medical professionals cannot agree that they are in fact preventable and on ways to prevent them. So it's not necessarily the type of infection that you're talking about. These are infections that have been shown with the proper protocols and the proper equipment and the proper procedures, they can be eliminated. So we're not really talking about those gray areas and borderline cases.
These are real simple, cut and dry.
Pretty cut and dried ones.
Let's go to the phones again. Sharon from Wilkes-Barre on the line. Sharon, thanks for being with us.
Thank you. I'm calling to make a comment and a question. My comment is my mom happens to be in the hospital, and she is covered by Medicare, and she was initially taken to the hospital by ambulance to be treated for a certain diagnosis of an impacted bowel situation, and apparently acquired pneumonia and also a blood infection within 2 weeks, and apparently needs to have excessive long-term care, which I feel could have been prevented. I haven't gotten all the answers yet, but to make her transition back home better, but now she needs additional care because her immune system is down and she's not as healthy as she could be to return home, which puts an excess burden on Medicare, and I do think there should be some kind of guidelines and a little bit more overseeing instead of cutting a check to Medicare as far as, money versus patients' well-being and just a little bit of oversight.
All right, and that's what this particular measure taking effect October of 2008 will do.
Mm-hmm. That's the idea behind it.
All right, we're going to talk more about it and, of course, its impact. In just a few moments, it is time for us to take a break. Welcome back. Our interactive topic tonight, a new Medicare policy that has some hospitals on the defenses. Here to talk about is Bill Levinson. He's a quality management consultant, and he's a member of the American Society for Quality. And also Paul Lyon from the Committee for Justice for All. Thank you, gentlemen, for being with us. The last hour, we discussed this particular policy, what it means for Medicare. They will no longer cover what they consider preventable mistakes in a hospital.
Correct. 5 types of hospital-acquired infections and several other types of preventable errors, such as leaving an instrument or a clamp, a sponge, any kind of device inside a patient during surgery, and a couple others as well.
And one of the things they won't cover is falls inside a hospital if you're under hospital supervision. We do have some messages from some callers. They want to know, will Medicare no longer cover falls? I believe they'll cover it if you fall at home.
Correct. Correct. They're talking about someone who gets up unsupervised and falls while they're in the care of the hospital and is injured and requires additional care as a result of the fall.
Another message we have here is, what about the responsibility of patients who are non-compliant? Is there a line drawn in the sand in regards to that?
I mean, I think a lot of these things are going to frankly have to be sorted out on a case-by-case basis. I can envision an appeals process where the provider will have to go to Medicare and say, look, this is not one of those prohibited events, and here's why, and go through the motions to try to get payment for something that they think does not fall under these rules.
And Bill, it's all to save some money. They think they can save Medicare some money doing this.
There's a considerable amount of savings to be had. The estimated cost, not just of these never events that aren't going to be covered, but of poor quality in general, is 30 to 60 cents of every health care dollar, which adds up to a considerable amount of money. People and employers who are paying more and more every year for health insurance should be aware that 30 to 60 cents of every dollar that they pay is going for wasteful activities, correcting mistakes that shouldn't happen, fixing things that have happened to patients, like hospital-acquired infections that don't benefit the patients. In some cases, they can't save the patient and the patient dies, as we've mentioned before.
From things that are preventable.
The estimates range from about 90,000 up to 195,000 people per year dying from these preventable problems.
Let's see what some of the viewers think. Grace from Carbondale, thanks for joining us, Grace.
You're welcome. I'm very happy to be on the air. And I am a nurse for over 50 years, and I'm really angry with this Medicare problem. Are they aware of the fact that I've worked all over this country? There is not one hospital that deliberately goes out of their way to not be sure that every patient that enters their door is cared for to the best of their ability. And I bar none. And are they aware that many small hospitals, if they are not reimbursed by Medicare, will have to close?
Well, Grace, let me ask you this. One of the measures mentioned in here is that they talk about is in situations where there's a surgery and a sponge is left inside someone and they have to reoperate again, they're saying they're not going to pay for that second operation. If they don't pay for that second operation,